Welcome to AMGA's Executive Pulse with Dr. Brian McDonough. Each episode brings you candid conversations with the leaders innovating in healthcare delivery. Healthcare moves fast, so don't miss a beat. Let's dive in.
Hello, this is Dr. Brian McDonough, and welcome to the initial episode of the Executive Pulse. And for an initial episode, we can't do better than having as our guest Dr. Stephen Beeson. Dr. Beeson is the founder of Practicing Excellence, a company he created after he wrote a book of the same name. Lots to talk about with Dr. Beeson. First of all, welcome to the program.
Delighted to be here. Thanks for having me.
Now, I'll start off by saying most people probably watching this don't know my background. They may know yours, but as a family doc speaking to another family doc, I have to tell you, I already like you because I know you believe in family practice and caring for the total patient. So why don't we start there and say, you practice for years, so you have that in your background as well as being a leader. Tell me where the core of family medicine really helped shape you.
It's interesting. People ask me, why family medicine in particular, and I've always deeply resonated with seeing conditions and diagnoses at the front end when people are first presenting, and the capacity and the ability to gather the initial symptoms, formulate your differential diagnosis, issue a treatment plan, and watch the advancement toward wellness and the longitudinal relationship of not only the diagnosis and their health journey, but what I found later, which is fundamental to practicing excellence, is the human connectivity and finding the person behind the diagnosis and taking that journey. And it was really good for them, for me to be able to be partnered with them, not just for their diagnosis, but who they are and what they want out of life. But it was deeply enriching for me. And the origin of practicing excellence was trying to replicate doing that really well from a clinician behind the exam room door.
You have focused on people, impacting healthcare by focusing on the capacity of people. Tell me about that.
Well, I found that, physicians and how we show up as care team members have profound impact on a lot of critical things that make healthcare better. Patient participation in a treatment plan, what it's like to show up for work, and do I love my job or not? The ability to access discretionary effort for healthcare team members to deploy effort to achieve important things in quality and experience and margin and retention of patients. All those things are highly dependent upon the behaviors and the language and the capabilities and the skills of the care team members and how they connect with patients, how they collaborate with each other, how it is that they lead. And what I found is there is massive variance in regards to our team members' capabilities of connecting to patients and forging that bond. So the patients walk out and say, best care team member ever. Everybody I know, love, and care about has got to come here for their care. Or how to become a really amazing teammate and show up in a way that we help each other, support each other, know each other, lean on each other, dive in to help each other. And all those critical things, those are all represented by skills that we bring into and behaviors that we bring into the clinical environment. And I found not only are they vital for organizational healthcare culture, but they're also things that people can learn and apply. So at Sharp Healthcare, originally in the Sharp Studio Medical Group, I was assigned a position to help and support the execution of what we call the Sharp experience to make care better for our patients and make care better for our care team members. I became very interested in the science of skill development, and human capabilities to take action to render better care, not only in terms of quality, but in terms of all these cultural proxies like the experience of our care team members, the retention of our care team members, the engagement of our care team members, and the experience of patients.
Let's talk for a second about that. You talk a lot about building teams, teamwork, the science of teamwork, all of those things. We're at a time now where just about every study out there talks about physician burnout. And I don't care what specialty you're in, burnout seems to be everywhere. How does the team approach help deal with that? I mean, are people feeling like they're just isolated and alone and their doctors fighting the battle? What's the problem?
Well, it's interesting. If you look at physicians in particular, burnout levels remain at about 50%, maybe a few ticks up of improvement over the last year or so, but still a profound issue. Physicians in particular are suffering from significant loneliness despite being with people all day, every day, in a sense of I kind of got to do this alone. And this is a hard burden to carry in terms of my day-to-day clinical grind. If I feel like I'm having to carry all this weight myself. And what we found is, the capacity to create a sense of esprit de corps in this together, there for each other. I'm going to know my teammates. I'm going to help my teammates. And we're going to not only operate as a team in terms of role clarity, but we're going to show up in a way where we are there for each other. We've got each other's back. And, we did a lot of work at the Sharper Steele Medical Group and later within Practicing Excellence, building skills to build these collaborative cultures to be really amazing teammates for each other. Everything from, how do we send good referrals to each other with appropriate workups and clear clinical consultations? How do we say good things about each other to our patients and to our colleagues as we make referrals across the system? To simply being there for each other when our colleagues ask for help. And those behaviors are under the hood of organizations where people say, I love coming to work and I love my job, because everybody in healthcare works really hard. I mean, that's a given. But places who have advanced the sense of team, the sense of there for each other, we've got each other's back, and we are taking behaviors to lift and support and to know each other and to identify the flashing red light of a struggling colleague and to say, hey man, how are you holding up? Each of those are a layer of behaviors. And one of the things that I found really, really interesting and helpful is advancing the skills of becoming a great teammate made the team better. And it was really enriching for the individual team member who was learning how to be there for their colleagues. And so in addition, we had done some research at Practicing Excellence saying, what is the impact of the presence of collegiality, the presence of friendship, the presence of collaboration, and what does that do to like coming into work as a clinical care team member? We found about a 55% reduction in burnout symptom probability when people described the area where they were as highly collaborative. So it became a great curriculum, if you will, in the skill building journey to advance the skills to improve healthcare.
This is the primary episode of Executive Pulse, the first, the premiere, and we're with AMGA. Thank goodness they're helping us, but also AMGA has a wide net of executives and physicians and leaders in all areas of healthcare. And I know one of the things you do is you work on team building sessions. You'll go into a facility and you'll get the teams to work together and learn many of the things you're talking about. I know where I practice and probably where most of the people who are practicing work right now, it's hard to get anybody to get out of the office, yet alone join a meeting like this. How do you do it? And how are you working to make that happen and facilitate it?
It's interesting that one of the things, in getting back to the journey of Sharp Healthcare and the Sharper Steele Medical Group, we had this ambition and hope to improve the experience of patients, improve the experience of care team members, reduce turnover, advance engagement, and all the things that are the cultural correlates to a healthy system that has the capacity for great results. And, we began the journey and, we were struggling on some of the domains of patient experience, team engagement, care team turnover, physician turnover. And we initiated what we refer to as a Sharp experience to try to become better on those domains. And, over the course of time, we were able to transform the patient experience from the 6th percentile for the care provider component to the 93rd percentile. We were able to reduce physician turnover from 18% to below 4%. We were able to take a razor thin operating margin to a much healthier margin for the group, able to grow market share for 10 consecutive years. And we're actually able to achieve the 95th percentile in physician engagement across the healthcare system. And people look at that and go, okay,
amazing numbers.
That's a really great journey, had that all happen. And, in reflection, the principal intervention was raising the capabilities and the behaviors of care team members, of physicians, nurses, staff, and leaders to better connect with patients, to better collaborate with each other, and to lead more consistently, reliably, and effectively. And the mechanism, the catalyst, the enzyme to bring those behaviors about was a skill building intervention. How do we connect with patients? What are the evidence-based behaviors that we deploy in the exam room that prompt the patients to say the best?
So how does a skill development approach like this work with all those time constraints?
Yeah, well, what I found at the end of that 10-year journey, it took 10 years to get it done. And we were pulling people into classrooms, we were doing retreats, we were doing meetings, and it was really, really hard to do. And we found in reflection that it was very tough to pull people out of clinical time. Having skill building and learning occurring out of the flow of work was disconnecting because people forget 90% of what they learned within a week. 95% of what we learned, we never apply. So we wanted to be able to rethink how it is that we could apply human development to change human behavior to drive healthcare outcomes, which is the reason I founded Practicing Excellence, which is thinking of raising human capability and enablement differently. It's learning skills in the flow of work while you're working. So you can query on what is now an app-based approach of, how do I manage a patient demanding antibiotics for viral illness? I don't want to go to a class for that. I want to know right in the moment before I enter the exam room what to do. So in the flow of work that is consistent with the challenges that healthcare team members have. And
that's the best way to do it. You're right. You're in the world. You're in action. It also isn't pulling people away.
Right. And the capacity to be able to grow the skills that align to organizational priorities. So as every organization has, we want to be in the 95th percentile for patient experience. We want to reduce turnover from X to Y, and we want to retain our clinical talent. Well, the only way those skills or those goals are executed is if we're doing the behaviors that allow those things to happen. And the mechanism for getting those behaviors to happen is a skill development approach. And I think the big take home that we took from certainly Sharp Healthcare and what I've been doing for the last 20 years in the healthcare industry is advancing the skills of healthcare team members that, number one, align to organizational goals. So if you're going to achieve a goal, we have to build the skills of our leaders, teams, and individuals to take the action to allow the goals to manifest. The only way you become the 95th percentile in patient experience is to do the behaviors across the clinical enterprise that prompt the patients to say, that is different here. And so it's aligning a skill development strategy to a goal. And we have also found, we work very hard in the Practicing Excellence skill building system to make it personalized for every learner, because every physician, nurse, APP, staff member, leader, they have their own challenges and the things that they want to develop and grow and the skills that are important to them to be able to have a personalized, contextualized learning experience. And the third that I think is critically important is the ability to scale it to everyone, to democratize the skill building journey. And the big reason why I took the Sharp Steele Medical Group and Sharp Healthcare such a long time is it's very tough to scale these things in the absence of using technology, AI, and personalized, aligned, scalable learning to across the clinical enterprise.
I want to move on to AI in a second, but before that, in one of our pre-interviews in prepping for this, one of the things that I thought of in talking with you is an observation I had from serving on boards and being chair of a department, all these different things, is there seems to be a disconnect, not in every organization, but in a lot of them, where physician leaders don't necessarily respect the administrations and their intelligence and the battles they're fighting. Administration doesn't necessarily respect the physicians and what they're doing. And without that mutual respect, they're loggerheads. They just don't seem to get along. Yet when I've seen them respect each other, I've seen incredible things done because they recognize that both require incredible skill sets and they recognize it. Have you seen that in your work? Have you recognized that as a barrier?
It's a very common scenario in groups that struggle with engagement to have challenges regarding how administration and physicians work together. I wrote the book called Engaging Physicians a number of years ago. And what I have found, what the literature supports in and out of our industry, is that there is a way of leadership behaviors, skills, and ways that we communicate that can build a shared purpose, collaborative environment between administrative leadership and physicians. That is a dependency for the organizational culture to raise the capacity to engage people, to get work done, and to trust one another. And I think it comes down to our ability to advance leadership skills, approaches, collaborative approaches, growth mindset, honor and respecting each other, and showing up in a way so physicians, administration can collaborate together on a common ground to execute goals that are vitally important for both of them.
And I did promise I was going to talk about AI. I don't think we can have a conversation on virtually anything anymore without bringing up AI. But I know in your work, where do you see it having an impact? Where do you see changes, progress, problems?
It's interesting, but AI adoption in healthcare is about 2 to 3 times higher than any other industry right now. And I think it's symptomatic for some of the challenges that we have right now in regards to the state of our workforce, the inefficiency of operations, the burden of clinical documentation. All of those things have made conditions for the rapid adoption of the shiny new toy, which is AI. And there's lots of implementations that are generating some subjective benefit, but still the definitive ROI is not yet fully being demonstrated. But we believe at Practicing Excellence, we have recently acquired an AI coaching company called Sageful. And the purpose of that acquisition was to build AI capabilities into the human enablement space, to build skills, to change behavior at scale that is personalized, aligned, that allows us to render measurable healthcare outcomes. And we believe, and we have found, that the capabilities of AI make all of that possible. The ability to formulate personalized learning pathways, the ability to take into account an organization's goals, mission, vision, values, and competencies, and embed that into a database that the AI agent can then access to create learning and guidance that is specific to the organization and what they want to achieve. And again, to make it personalized and to incorporate learning preferences and DISC assessments and individually attributed data, so the individual learning experience for a leader or a teammate or a physician or APP is customized and unique for them. And then certainly technology has a capability of going and scaling to everybody. Because if we want to advance the skills and behavior change at scale, we got to democratize the entire learning experience. It's not, there's beautiful work that occurs in cohorts of 30 or 40 going through a leadership development course, and we support that. But if we really want to transform the organization and change behaviors at scale to render a future state for patients, for each other, as highly effective leaders, to advance our safety culture, we've got to democratize that process and create the capacity to scale it, to personalize it, and to align that to organizational goals. And AI provides that capability for us.
That's a great point you're bringing up, the whole idea of democratizing, because I think you're right, especially in healthcare. There are so many people who have a level of sophistication in the areas where they work. And I mean, it's hard for anyone to look at an organization, especially let's say a hospital or a healthcare system, and understand operations and understand the roles of different people. I know in my work, getting involved with informatics and helping to build electronic health records for healthcare for the entire hospital, that was very hard because as a physician, I didn't even take into account that when you send someone to the ICU, I would just write an order, transfer to ICU. I didn't realize there's somebody going with them with a monitor to the ICU. There's someone getting the ICU bed ready. There's someone in the ICU who's being transferred out. And the level and the degrees and the number of steps, something that, in my world, it was like, I'll write it and so it will happen. It wasn't that easy. And when I saw it in a computer setting, I saw that. And yet a lot of those people are never involved in these meetings where you talk about skill development. They're not even included because they're busy making the donuts, so to speak. But now there's that opportunity.
It is. And I think that the big take home for listeners is that, we all have ambitions for what we want to become and do and achieve as an organization. We've got board level goals that come to us, our dashboard that represents our organizational performance. And we have found again and again in our industry and outside of it is that in order for us to achieve those goals, we've got to raise the capacity of our people, investing in our people with the skills, behaviors at scale to be able to do the things that allow those goals to be achieved. And what we have also found, particularly in the younger generations, is that they expect when they join a healthcare system, how are you going to help me ascend and become better at my work for this work and whatever I do next? And this idea of I get to join a healthcare system where I get to grow and ascend my skills and my capabilities, I think is a critical driver of engagement. Gallup has demonstrated that again and again, that I have a chance to grow and develop here at this healthcare system. In addition to raising the capacity to take action, to do behaviors that allow specific goals to be achieved. So again, as I reflect on my professional journey at the Sharp Utility Medical Group and Sharp Healthcare, again, it was raising human capabilities, raising the capacity of people to achieve the results. And that was the underlying mechanism that allowed us to get the transformative impact that we're able to achieve.
Our initial guest on Executive Pulse is Dr. Stephen Beeson. It's been a fascinating conversation. Dr. Beeson is the founder of Practicing Excellence. Before we go, is there something I did not ask you? You were like, I wish I could have talked about this that you'd like to mention, because we do have a great audience. I mean, from all areas. So it could be a lot of fun if there's something you wanted to share in addition.
Well, one of the things that's super exciting is that AMGA and Practicing Excellence have now forged a partnership in terms of how do we use AI-enabled human enablement to change behaviors at scale to achieve healthcare outcomes. And we're really excited about the opportunity to help and support AMGA members in the thing that I believe so strongly, with such good evidence, that raising the capacity of people to create behavioral change at scale is a powerful mechanism to make healthcare better. And my ultimate goal in life is to have the people that are delivering care and receiving care to be deeply enriched by the experience within the healthcare industry. I mean, it breaks my heart to see that half of all clinicians are suffering from burnout, and even higher numbers of nurses and even higher numbers of leaders. And the most beautiful, amazing things about healthcare, which is impacting the lives of the patients that we take care of, being collaborative with each other, help each other, support each other, lift each other, know each other, and be there together in purposeful work that's bigger than any one of us, and to lead in a way that allows the people that you lead to soar. Those things are all accessible through a mosaic of behaviors that allow those realities of patient connectivity, team collaboration, and leadership effectiveness to really manifest. So we can say, man, we're doing amazing work with our patients in terms of our quality and the experience and what it's like to receive care here. And it's a really incredible place to work. And we believe that this systemic human development strategy and intervention that is now, capacitated through technology is a really powerful way to bring that about.
What a great way to conclude the interview. It's interesting what you say, because just a few weeks ago, I was working with one of my residents who first year resident, they feel all the pressure. Those days, we remember how hard they are and how many hours. And the resident made a very great diagnosis, and which will make a difference in a person's life. And I just took a second and said, I've been doing this forever. You must think I'm like your grandfather, but let me tell you something. It gets no better than this. What you just did is the most important thing you did this week. I can tell you it's the most important thing I've been involved with this week, but you made a difference in a person's life. And if you never lose that joy and you don't let anybody take that joy from you, you will have a great career, but it's hard. You have to keep focusing. And I think what you're doing is helping people focus on what really matters. And I love that you said that leaders also are burning out. I don't think people who are in administrative roles get enough credit. I think, as a physician, often physicians say, oh, they're going home, it's early. They don't see that world as well. And I think the greater that understanding, the greater practicing excellence and groups come in and do that, I think the better results we'll have. So I consider myself like one of the luckiest people on the planet being able to interview people for Executive Pulse, and starting off with you has been fantastic. It only makes me more excited about future guests and future conversations. So really, thanks for taking the time. I really appreciate it.
Thank you for joining us for Executive Pulse. This podcast is brought to you by AMGA. For more information, please visit amga.org.